Hello, my name is Dr. Robert Findling. I'm the Director of the Division of Child and Adolescent Psychiatry at University Hospital's Case Medical Center and a Professor of Psychiatry and Pediatrics at Case Western Reserve University. Today, in this posting, I'll be talking a bit about an important topic. I'll be talking about factors associated with placebo response in randomized controlled antidepressant trials of juvenile major depression. Now, in this blog, I will be considering a paper that was recently published by Bridge and colleagues in the American Journal of Psychiatry. Now, overall, when young patients participate in acute placebo-controlled trials of antidepressants for major depression, both youngsters who receive active medication as well as youths who receive placebo overall experience symptom amelioration. More simply put, youngsters who receive placebo on average have improvements in their symptoms. In addition, youngsters who receive antidepressants also generally on average experience improvements in their symptoms. So, whether or not a medication is determined to have efficacy or not is really dependent on, at least in part, on whether or not active medication treatment is associated with greater symptom reductions than placebo. Now, understanding the determinants of placebo response is really important, both for scientists as well as clinicians. Now, for scientists who design these clinical trials, understanding the underpinnings that perhaps might inflate placebo response is important. If these factors are identified, well, then studies can be designed with these factors in mind. Now, for clinicians, it's important because the results of such trials provide the scientific evidence that really clinicians should incorporate into their decision-making processes. So, in another way of putting it, the more precise and methodologically stringent a study, the greater the likelihood that the results of the study will have salience in the clinical setting. Now, let's talk a little bit about the results of this paper. What this paper found was that the one best predictor that was associated with a higher proportion of placebo response was the number of sites that recruited youngsters into these studies. Put in another way, the fewer the number of study sites, the lesser the degree of placebo response. Now, I should point out that more modest degrees of depression severity at study entry was another important factor associated with a higher placebo response rate. Now, however, this factor was associated with a smaller influence on placebo response than the number of study sites. So now with these key factors identified, hopefully, subsequent placebo-controlled studies in juvenile major depression will incorporate these two key considerations into the trial's methodologies. And this newfound knowledge might allow for more precise and more informative clinical trials in juvenile major depression. Now, of course, the reason we do all of this, or any of these studies should be performed, is to make sure that better knowledge leads to better patient care. Now, please feel free to comment on what I've talked about today by clicking on the Discuss link. It's a button, and it's located underneath this video screen. I'm Dr. Robert Findling. Thank you for watching.